Welcome to Tea Time. I'm Dr. Casey, and I'm here today with Dr. Patrick Fratellone. Dr. Fratellone is an integrative medical doctor. He has extensive training and experience in supporting and treating cancer, heart disease, autoimmune disease, Lyme disease, and so much more. He's also an expert in herbalism and apitherapy, and he practices in Fairfield, Connecticut, and in Manhattan. So Dr. Fratellone, thank you for joining us today.
Thank you for having me. It's a pleasure.
Yes, yes. So let's get right into some questions.
Okay.
This time of year, what are some of your go-to favorites for addressing seasonal allergy types of symptoms like the sneezing, sniffling, runny nose that people can get? So many of us can get that.
So, of course, the people, individuals always turn to Claritin or Zyrtec or Benadryl. As a cardiologist, I don't like any of those. Not that they don't work, but people tend to get the long-acting ones, Claritin D, Zyrtec D, and the D is pseudoephedrine, which could cause a racing heart. So for me, that's not what I want to use. So people say, well, I can't get rid of it. So first I said, well, have you tried stinging nettles? And I make an allergy tea, stinging nettles, calendula, a little slippery elm in it, and it's great for allergies. Some people aren't tea drinkers and, don't want hot or cold tea. So there is a product by Orthomolecular, I believe, called Natural Dehist. That's a great formula to get because not only does it contain the nettles, but it contains quercetin. And quercetin is a bioflavonoid for allergies. So I have to say, orally, a lot of stinging, a lot of natural dehist, like 6 a day, or you could have 2 cups of stinging nettles. And stinging nettles works better than an allergy medicine.
Yeah, I love nettles. It's so nice. And it's nice too, because it's one of those plants that is actually, it's native to this area. It's found in lots of places, but it's around here. So it's not like, there's nothing wrong with
you just have to worry about the prickly thorns on it.
Yeah. Although those can be therapeutic too, if you need some pain relief.
Yes, they can. But it's amazing that it is a native plant of Connecticut. And I think most people probably have it in their backyard. They regard it as a weed, right? And they don't think, wow, this is a powerful plant. So I know when I moved to Black Rock, Connecticut, when I went, what convinced me to buy the house that I finally moved into was I wanted to see what was in the back, and it wasn't fenced in. So I saw a whole bunch of nettles. I saw mugwort, right? Because I love mugwort. I saw some artemisia, and then I saw lily of the valley. So this house was for me. And I left all those native plants. I actually took some in different areas. So now I have areas where there's just native herbs that I do wildcraft myself.
Beautiful.
Which is fun. It's fun.
Do you ever make tea from the nettles that you have in your yard?
For me, I do. Not to sell to patients. Most of the herbs that I get, as you know, I buy them from Mountain Rose or Star West Botanicals. I buy them in bulk. But for me personally and family members, I use my own nettles in the back. And another thing is, people want, if they're a younger person, they could go see an allergist, and the allergist will start shots. I don't find injections once a week to be effective. What I do find more effective is slit therapy. And SLIT stands for sublingual immunotherapy. So based on their allergy test by blood, IgE, I then write the prescription for them to have antibodies made against the antigen. So the antigen is the allergy. A company makes for me antibodies against that allergy. So if the person has 15 allergies, years ago, when I first joined up with Allergy Choices, which is located in Washington State, they would have 15 little bottles, one for every allergy. Today, because of technology, we put them in dilutions. I write the dilution, so you could get 15 of your grasses, molds, whatever, in one bottle. You do 1 drop morning, afternoon, and bedtime, and you could desensitize yourself against your allergies in 6 months.
That's powerful. That's awesome.
So, so those that just have like a little sniffle, that's one thing, but you and I know that people suffer, tremendously as the season's coming up, whether it's rhinitis, the eyes. And I think sometimes, the nettles and the orthomolecular natural dehisce work, but some people really want it done. They don't want to have this. And that's where split therapy comes in.
Yeah, excellent. Thank you for sharing that. That's really good advice. Not medical advice for anyone listening, but really good insights. And do you think food plays much of a role in the seasonal allergy picture? Can you talk about that for a moment?
Well, you and I know, so we really, during this season, you have to not eat inflammatory foods. So I think when someone comes with allergies, they're assuming that it's the maybe the trees. I always run, as you do also, an IgG RAS test, whether from biotech or ALCAT, where you find out the gut allergies or delayed allergies. When you're doing environmental allergies, that's an IgE, which is immediate sensitivity. I, at the same time, automatically run a food allergy panel. And you'd be surprised that the same people that think they were allergic to, let's say, grasses and different trees have dairy allergy, number one, a gluten allergy, and some nightshade allergy that they didn't even know about, because they ate the bread and they didn't get a rash, but it was the gut that did all the problems. So yes, I really do think that when any individual healthcare practitioner dealing with allergies has to do environmental as well as food allergies.
Yeah.
And you do a lot of food allergy testing.
I do. Yeah, I do. And it's always, explaining that there's so much to explain with the IgE, the sensitivity rather than the immediate allergy. There's so much to contextualize so that people understand kind of not only how to apply it, but what does this mean when I don't know, like I eat an apple, I don't get a reaction right away. So how is that actually causing anything in my body? So it's kind of talking through all of that. But yeah,
and that's why it takes a lot of time, and that's why you as a healthcare practitioner, as a naturopathic doctor, you need to explain this, because you people don't get it. Well, I don't have a reaction to dairy. Well, they do, but no one have explained what the reaction was, and then what is the cascade effect. Gut leads, I always say that the gut is the pathway or the gateway for all information. So if you have a IgG allergy to food, the spreads all over the body. So before you know it, that sinusitis really came from gut allergies that you never addressed. And it does take a long time to explain it, but it's well worth it.
Yeah. And it's not necessarily like the quickest fix, but the symptoms can improve fairly quickly depending on the severity and, different factors, but it's not like just the next day you necessarily have an improvement in
but I do tell people, and you know this too, that within 2 weeks they could feel a whole lot better than when they presented following elimination and certain supplements and certain teas, if they get the proper testing. I don't think going to the gastroenterologist is going to give them the answer. They need a little more metal detective work, because the gastroenterologist, in all fairness, is there to do procedures. They're not there to really figure out the nuts and bolts of GI inflammation. There is to look in, whether endoscopy or colonoscopy. They're not doing the testing for, let's say, small intestinal bacterial overgrowth. They're not doing the testing for H. pylori, and they're definitely not doing food allergy testing.
Yeah. So let me ask you a little bit of a different question now.
Okay.
I know you are a very experienced with apitherapy, and just, a lover of bees, and you've inspired me, and your learning about apitherapy from you when I was in med school has allowed me to help save bees. When I see a bee that's somewhere it shouldn't be, I am comfortable now picking it up and moving it somewhere else. So thank you for that. But can you talk a little bit about honey and how we can use it, to support the body? And if someone's looking to buy honey, if they don't
Where
have
should I
their
buy?
own, how can they find a good one?
Yeah, bees to me are sacred. I became a beekeeper 14 years ago, and started keeping bees. And actually, the interest came from reading a Scientific American article in 1972, probably before you were born. There was a 1972 article on the wiggle dance, the wiggle waggle dance of honeybees. And I was 14 years old. And I read this and I was fascinated because I was fascinated with biology. And I read it and I thought, this is interesting that bees could communicate when they go out and they forage for pollen. They come back to the hive, do a wiggle dance, and that dance gives the longitude and latitude of where that patch of flowers were that the bee came back from. Fascinating,
Amazing.
right? Really communication. So, and in the same Scientific American, was I had the good fortune of reading about a woman named Jane Goodall who went on to become a primatologist. Fascinating stuff. So I put the bees down, never thinking that, 14 years ago, I would say, I want to learn about bees, and became a beekeeper. And I became a beekeeper because I attended a conference in Chicago on apitherapy. Apitherapy is using all the components of a beehive medicinally. So what are the components of a beehive? So I learned about it, and they are, we all know honey is a major component, which I'll talk about, but the other components are propolis, which I'll briefly make up, royal jelly, and bee venom. That's the four major ones. Yes, you could get bee bread, you could get pollen, but those are the four main ones. So I learned this conference, I joined this, I went to the meeting, I joined, and then I kept going for the next 3 years, and then they said, would you like to be a member? And I joined, and then I became a board member. And 2 years ago, I became the vice president of the American Apitherapy Society. And I'm very proud to be the vice president, along with my another physician, Chris. He lives in Oregon, he's the president. And, what we do is we educate practitioners and lay people about the benefits of a beehive. That bees in 1920, 9 lectures on bees was given by Rudolf Steiner. And Rudolf Steiner is the founder of the Waldorf School. And Rudolf Steiner said in 1920 that in 100 years, all bees will be gone. That was 2020. Well, we started losing bees 8 years ago in 2012. The little 2012, 2010, and they were dying off. And people need to realize the reason why it's great to save bees is if we lose bees, we lose a third of all the food that we eat. A third. You will lose so much, and humans won't be able to survive without bees as pollinators. Now, bees are pollinators, but there are other animals and insects that are pollinators too. Butterflies are pollinators, bats are pollinators, dragonflies. But honeybees are the major pollinator for a third of the crops. So you won't have blueberries. You won't have almonds. You won't have a lot of things. And Michael Pollan talks about this, who wrote The Botany of Desire, and he wrote The Omnivore Dilemma. But so many people, so Rudolf Steiner turned out, but you're right, it was called colony collapse disorder, and it was because they thought it was cell phones. I'm sure that has a role, but the reason we started losing bees is because of herbicides and insecticides and things like Roundup. And bees started dying. People then we got scientific people involved. They banned a lot of pesticides, although we have to ban more. So that really kept me going to say, geez, I'm gonna continue keeping bees. So 1 hive led to 2, or led to 3. Now I have 4 hives. Yeah, there are 600,000 bees in the middle of the summer, in my backyard, pollinating everywhere in the area. Bees fly a good 50 miles to pollinate. And in the topic with allergies, you should be using honey every day, but you should be buying honey from your region where you live. So I have a person said, oh, I love Tupelo honey. Tupelo is from the Tupelo trees on the Gulf of Mexico on the Panhandle. Well, if you live in Connecticut, having Tupelo honey is not going to help your allergies. You need honey from the Northeast. And why? Because the bees have, so people say, well, how is this going to help? Because the bees have collected the pollen from those trees. So the honey is like an antidote to your allergies in the Northeast. So you have to stay with Northeast honey. So that's really important. So people say, well, I want to do Manuka honey. Well, Manuka honey is great for many things, but it's not going to help your allergies if you live in the Northeast, where you want to buy from a beekeeper. And people say, well, what do I buy? Well, first of all, no offense to people who make honey, and I'm one of those people, but you do not add sugar to your honey. So when you're going to a store, try not to buy the teddy bear honey that we know extra sugar was added. You need to buy raw organic honey. And sometimes it's not the liquid that falls right out of the bottom. You have to take it out with a teaspoon. And the best raw honey is usually white. So when I collect honey, and I collect my own, one hive, 3 boxes tall of the Langstrom hive, gives me 85 pounds of honey, one hive. So I have 80 times 4, so 320 pounds of honey. Now, if I took 320 pounds of honey, my bees would not survive the winter. So I take 20 pounds from each hive. So I get 80 pounds of honey in a season, because that's me. I'm not depleting the bees. I need them to survive, because bees survive on the honey they stored for the winter. People say, well, where do bees go? They live in that hive. They stay at the center of the hive. The queen is in the center. All the bees, the worker bees, are flapping their wings, keeping her at a temperature of 102 degrees inside the hive. But they need the honey to make their wings flap. That's their food. So if you rob too much honey, the bees will die. So I only rob 20 pounds out of each hive. So I get 80 pounds during the season. I can tell you, it goes quick. I bottle it, I give it away. I mean, it just goes very quickly. I sometimes sell it, but only sell it to, the reason why I don't sell it publicly is because then the New York State or Connecticut Department of Health would have to investigate my hives. And you know what? Not for anything. I don't want anyone. My hives are, I mean, I don't use pesticides. I use all natural things to kill varroa mites or whatever is bothering my bees, any sickness. But I don't want the Department of Health, so I just give it away. But I never give too much, and people go, oh, I need more. I don't do that because it's not right. I do make candles from my beeswax, which is great. So I use and probably the most important thing to do is I sting people with bees. So I use bee venom. And people say, why do you, bee venom is great for autoimmune disease. There's multiple peer-reviewed journals that have been published on autoimmune, lupus, rheumatoid arthritis, multiple sclerosis. I saw a patient today with ALS, which is Lou Gehrig's disease. He's going to start a bee regimen with me. So I think I go, so yes, people are listening and say, well, he's an MD. Yeah, but I'm going beyond because I'm a beekeeper. And, you know, you technically, it is a non-FDA approved treatment, so I don't charge the patient. It's out of my goodness. And all I ask is for a donation to the American Apitherapy Society, because that will help our society, which I'm the vice president, train more doctors. And I think it's giving back. So I started raising bees to save them from colony collapse disorder. And now it's turned into what was a hobby is now a passion, which is now my life. As you could see, I mean, bees are so sacred to me. Honey is sacred to me. And you know, people say they've found honey in the tombs of the pharaohs. Honey never goes bad, never spoils. So, you know, when you think about it, and if you really get into reading about bees, and there's wonderful books, it is amazing the society that they have. A professor that spoke out of Cornell, where they had a beekeeping school, he wrote a book called Honeybee Democracy. And I have to tell you, honeybees have such an order in their hive that if society followed bees, we wouldn't have everything that's going on today. And I truly believe that. They're just incredible creatures. And it's nice. You got to see them firsthand in school, when you were in medical school. And, the students that I'm teaching now, I'm going to bring some bees before they graduate so I could show them how I sting patients. You can't just randomly sting a patient. You want to make sure they're not allergic. So all these things. But if you do it properly, and anyone could come to the AAS meeting, it's given every year. We didn't miss COVID. We do it through Zoom. But this year we're having it again. I think we're going to have it probably in the Northeast this year. And anyone come, doctors, nurse practitioners, naturopathic doctors, acupuncturists, and even just the layperson, your patients could come because they sit there and they just don't believe it. They just don't believe how wonderful they are.
Yeah. Wonderful. Well, I will put the link for the American Apitherapy Society. I'll put the link below. So if people want to check it out, they can.
Yeah, I think it's apitherapy.org.
Okay.
And everything I stated, you could read about me, the president, the treasurer, the members we have, and find out when the next conference is. And they're not these absorbent course conferences, because we understand that we want the general public to come. And for those animal lovers like you and I even sting dogs. You have a dog with arthritis, I will sting the dog. But, it's harder to push all the fur out of the way and to get to the skin. Dogs cry, but you cannot believe it. My dog has a heart problem that when I took him home and he went out, he got stung because he put his nose right up to the hive as the bees were flying out, and they stung him a couple of places. He ran away. He learned not to go near the hive again, but it was just because it increases your immune system. So it really is great. And I sting myself a little too much. I sting myself 18 times a week, purposely along my spinal nerves. My son does it for me. He said to me yesterday when he was stinging me, he said, "Dad, I have to realize, God, when I have to give that eulogy when you're no longer here, I have to mention that I stung you every day, every week for years." And he goes, "I never thought I would handle bees." And he does. He handled bees very well. He's great at handling bees. And I stung him when he had Lyme disease. So now he's stinging me. So why do I sting myself? One reason is that beekeepers have a very long longevity. The average beekeeper lives to 96 to 104. Documented. Charles Mraz lived, many beekeepers. There's a couple. C.C. Miller was a doctor, gave up his practice to raise bees. He wrote a book, 50 Years of Beekeeping, and he lived well into his early hundreds. So I said, you know what? If I could be healthy and live longer, so I sting myself. So I think it's really, and there's so many benefits, and people say, well, what's the benefit? Well, bee venom contains melatonin, which is an antioxidant, an anti-inflammatory, and an immune modulator, immune booster. So bee venom has been used for centuries for many things. And, one of the beekeepers, the way it became medically inclined, one beekeeper, C.C. Miller, he was injecting himself because of arthritis. He said, God, it helped his rheumatism. So then papers were done, studies were done. It's too bad that the conventional doctors don't refer to more apitherapists for treatment, because it does wonders.
It sounds like it. Thank you for sharing all that. And this is probably a good place to wrap up. So I'm gonna, like I said, I'll put the link below for the American Apitherapy Society, and also I'll put a link to your website.
Okay.
Yeah, thank you so much for being here and sharing but sharing some of a little bit of your wisdom and insights. Yeah, and I look forward to talking with you again soon.
Okay, thank you. Bye.
Bye.